Thyroid function test. A small introduction about this. Thyroid function tests are group of tests that are designed to assess the functioning of thyroid glands. Here we have to understand this group of tests is not just limited to the laboratory. It is also involved some of the radiological analysis. Okay, some scanning is to be done also to encourage or to observe the proper functioning of thyroid gland. The significance of thyroid function test increases when tests are matched with the results from other disciplines. Now, just we do whatever analysis we do in the laboratory is not enough. Okay, so the importance of what we do in the laboratory regarding the thyroid function is increased when we match the results that we get from other disciplines. It can be physical examination, it can be radiological examination. So based on the results of all these things together, we take a significant decision regarding the thyroid function. So what are these other disciplines? These include radio imaging, physical examination, sometimes patient history also. So these are the other things that are required as supplementary to make a decision based on the results we get in laboratory. So now this is one important information that needs to be told. So it is emphasized that a single thyroid function test is not absolute in diagnostic accuracy. Okay. So what it means is one test, as you told, hormones. Okay. So just hormones are not enough to make a diagnostically accurate decision. So it must be thus a careful selection of such tests, okay, various other tests, so that their combination can give us the proper data, complete data, which would enhance the diagnostic accuracy. Okay, so what it says is one test is not enough to make a decision. It's not diagnostically accurate. We have to consider combination of the test. By this, we'll get more information regarding the thyroid function, and it gives us more diagnostic accuracy. More accurately, we can make a decision regarding the functioning of thyroid glands. So now let us focus for a few minutes on need and role of thyroid function test. Okay, why do we actually require thyroid function test and what role it plays? Number one, we needed to assess the functional status of the thyroid to see if the thyroid is functioning normally, is it functioning abnormally. Okay, to check if it is normal or not, we require thyroid function test. To characterize the anatomical features of the thyroid gland. Okay, to see if there is any anatomical growth, additional growth that has happened. It may be a tumor or any other cyst may be in thyroid. So we require thyroid function test to check the anatomical features. By laboratory, we cannot check the anatomical features. We require radiological assistance here, but it is also a part of thyroid function test. And to possibly evaluate the cause for thyroid dysfunction. Okay. To see what could be the probable cause for a dysfunction if there is a issue or if there exists a issue regarding the abnormal functioning of thyroid glands. Okay, so why do we need to do this? To assess the functional status of the gland, to characterize the anatomical features of the thyroid gland, again to see any growth is there or a tumor maybe, to possibly evaluate the cause for thyroid dysfunction, to understand the cause for why the thyroid gland is functioning abnormally. The classification is very important. Now this here, thyroid function test can be classified based on the functions of the gland. Okay, thyroid has different functions in our body. So based on each function, we can categorize our own test to see if that function is happening normally or not. Number one, we have test based on primary thyroid functions, test measuring blood levels of thyroid hormones, test based on metabolic effects of thyroid hormones, scanning of thyroid gland, and immunological test to detect autoimmune diseases. Okay, so this is how thyroid function test is classified. I'll repeat: test based on primary thyroid function, test measuring the blood level of thyroid hormones, test based on metabolic effects of thyroid hormones, scanning of thyroid gland, and immunological test to detect autoimmune diseases in thyroid gland. So this is the classification of thyroid function test. So if you see carefully, almost other there are different disciplines involved here. Okay, can we do scanning in the laboratory? No, it is not possible. So we require radiological assistance. Okay, so there are many disciplines being involved together to form or to take a decision on thyroid function. Okay, so test based on primary function of thyroid. We have radioiodine uptake studies and turnover studies, RAI and RIU. We have iodine 131 in serum, T3 suppression test, TSH stimulation test, and TRH stimulation test. So what is T3? T3 is a hormone produced by the thyroid gland. TSH is thyroid stimulating hormone produced by the pituitaries, which in turn stimulate production of T3 and T4. TRH is thyroid releasing hormone, which is produced by the hypothalamus, which acts on the pituitary gland to produce TSH, which goes and acts on thyroid glands and produces T3, T4. Now, to understand any diseases with the endocrine glands, we have to not only check the gland but also this stimulating hormones. Okay, so a dysfunction in thyroid can be linked to pituitary. A dysfunction in pituitary can link to hypothalamus. So by this pathway, this flow chart, we can say TRS also plays a very important role in thyroid function. Okay, so we have to check hypothalamus, pituitary, and thyroid. Right. So radioactive uptake studies. So this we rarely do it in the laboratory. This is done by the Department of Nuclear Medicine. Okay, they are responsible for anything that is related to radioactivity and thyroid. This they do it regularly. So iodine plays a very important role in metabolism of thyroid hormones. Okay, very important. Iodine plays a very important role. A deficiency of iodine causes goiter. So iodine is directly linked to the thyroid gland. Short-lived radioactive isotopes of iodine, that is 131 and 123, are preferred to use to check the for uptake studies. Okay, so this is the basic information. 10 Ci of iodine 131 is given orally. Then we measure the accumulation of this radioactive iodine in thyroid externally after 24 hours. Okay, so what is the basis of radioactive uptake studies? First, a radioactive isotopes of iodine either 131 or 123 is used. Out of this, 131 is more commonly used than 123. So 10 cc of that is given orally to the patient. We check how much of this radioactive isotope of iodine is going to accumulate in the thyroid, and we measure it from outside after 24 hours. So our role, we actually don't do this test. This test is done by radiology department to check how much of the radioactive isotope is deposited in the thyroid in 24 hours. So if there is faster turnover, more turnover of thyroid is happening, that means there is more deposition of thyroid is happening, iodine is happening in thyroid. It is indicating that thyroid glands are having hyper functioning. That is, they are functioning higher than normal, more than normal. If more iodine is getting deposited than the normal in 24 hours. If the turnover is slower, that is deposition of iodine is lesser than the normal rate in 24 hours, which indicates there is less functioning of thyroid glands. Because if you see the formation of thyroid hormones, iodine plays a very important role. Without iodine, thyroid hormones cannot be produced. Okay, so more and more deposition of radioactive iodine in 24 indicates there is higher functioning, hyper functioning of thyroid glands. If the deposition of radioactive iodine is lesser in 24 hours, it indicates it is hypofunctioning. There is less function. So what is this normal range? A range of 15 to 35% of deposition indicates normal. If it is less than 15%, it indicates less functioning, hyperfunctioning. If it is more than 35%, it indicates hyperfunctioning. So how do we do this test is not really very important. Okay, because we are not going to do it. We have to understand the basics of uptake studies. That's it. So this test is getting affected by other external factors also. So the deposition range can change with the dietary intake of the population. So this is not set for one population. Okay, so it's not one size fits all. It's not for everyone. So it is from one population to another population. So people who are living in coastal areas, okay, their range will be slightly higher because of the food and water that they take normally has more iodine concentration. So it changes the range to slightly higher. And people who are living in hill stations, okay, where iodine is comparatively low in food and water, their range will be on the slightly lower side. Okay, so post analytical factors which are very important to take a decision. So interpreting, okay, so any abnormally high RAI uptake, radioactive iodine uptake, is usually consistent with hyperthyroid state, as we have discussed, like endemic goiter and some cases of non-toxic sporadic goiter. Okay, abnormally low, if it is less than 15% uptake, it's characteristic of hypothyroidism. So let us just have a overview to summarize what is this radioactive uptake studies. So iodine plays a very important role in metabolism of thyroid because it is a precursor for thyroid hormones. Isotopes 131 and 123 are used to check the uptake of iodine by thyroid glands. 10 cci of iodine 131 is given orally. Thyroid accumulation of radioactive isotope is measured externally after 24 hours. If the range, if it is more than 35% of iodine is getting deposited, it means there is hyperfunctioning. Anything less than 15% indicates hypofunctioning of thyroid glands. The ranges, the normal range keeps on changing based on the dietary intake of the population. So interpreting, higher RAI uptake is usually consistent with hyperthyroid states, endemic goiter, and some cases of non-toxic sporadic goiter. Abnormally low uptake is characteristic of hypofunctioning of thyroid. The condition is called as hypothyroidism. So continuing, the next test is urinary excretion of iodine 131 and T index. Okay, thyroid index. So what is it? We'll see. So renal excretion is indirect evidence of thyroid function. So proportion of administered dose excreted is inversely proportional to thyroid uptake. If excretion is higher, then the uptake will be lower. Okay, so that is how indirectly we check the thyroid function based on how much amount of iodine 131 is getting excreted from the body through urine. So 24-hour urine is collected accurately and radioactivity is measured. Okay, iodine 130 radioactivity caused by iodine 131 is measured. In normal range means a normal thyroid function is indicated when a person excretes around 30 to 60% of administered dose of iodine 130. Okay, anything less than 30% inversely related. So it means the thyroid functioning is higher, that is hyperthyroidism, it can be seen. Anything more than 60% is an indicating that thyroid is not taking up iodine 131. Okay, the required amount uptake is very less, so it indicates that thyroids are doing less function, means hypothyroidism. Okay, so T index, the activity is measured in urine sample after around 8 hours, 0 to 24 hours, and 0 to 48 hours. Three different time period we have to measure. T index or thyroid index is calculated, T value is calculated. The excretion in the first 8 hours expressed in percentage divided by excretion into the first 24 hours as percentage into excretion in the last 48 hours as percentage into 100. Okay, so normally we should get a T value between 2.5 to 12. Now why I'm telling you this is, so you are not actually going to do this test, but you might get a value as a supplementary analysis. Earlier during the introduction to thyroid function test, we have seen that one uh, index is not enough. One test is not enough to take a diagnostic decision. Okay, to see if there is any evidence supporting hypothyroidism and hyperthyroidism based on the hormonal analysis that you do in the laboratory. You should know how to interpret this T value. You should know what is the uptake value. All these things are required for making a accurate diagnostic decision. For that reason, you have to study all these things. So normal value of ranges between 2.5 to 12 for T index. Anything more than 17, that's indicating of hyperfunctioning of thyroid glands. Anything less than 2.5 is an indicator of hypofunctioning of thyroid glands. Next is thyroid clearance rate. Okay. The amount of iodine 131 that is accumulated in thyroid over a fixed interval in relation to the mean plasma concentration of 131 midway in that period is called as thyroid clearance rate. Normal value is between 60 ml per minute. So how do we calculate it? Thyroid 131 accumulation rate divided by plasma 131 concentration, which is midway during the 24-hour time period. So high clearance rate is indicating hyper functioning of thyroid glands. Lower value is indicative of hypothyroid status of the gland. Next is serum Pbi131. So administered 131 dose of iodine accumulates in thyroid gland and appears as a labeled hormone bound to proteins. As you remember, for precursor, as the precursor of uh, production of thyroid hormones, iodine is required. So uh, uh, when you inject or input any radioactive isotopes, so it is going to bind to these hormones, and these are then becomes labeled, which can be observed by the technician. We can observe it because it is labeled and it is going to produce radioactivity. So if anything around 35% is normal, considered to be normal, more than 50%, that is hyperthyroidism. Okay, so D3 suppression test we'll see in a short time. So till here is going to, we are going to have a brief summary. So radioactive uptake studies, we use short-lived isotopes of iodine, radioactive isotopes at 131 and 123. 131 is commonly used because the reason behind this is iodine 123 is not available in India. Only iodine 131 is available. Okay, so 10 Ci of iodine 131 is given orally to the patient. We don't inject it. We don't do an IV administration. We give it orally, and then we measure the accumulation of this radioactive iodine in thyroid glands after 24 hours, and we do it externally. We don't open and see. We do a radiation counting from outside. So faster turnover means more accumulation of thyroid, it indicates hyperfunctioning. Slower turnover indicates hypofunctioning. Normally, it should be between 15 to 35%. However, this range changes with the dietary intake of the population. How much iodine the people are taking, that also plays a very important role in this study. That's one of the factors. Okay, abnormally high intake of uptake of RAI is usually consistent with hyperthyroid states, endemic goiter, and some cases of non-toxic sporadic goiter. Abnormally low thyroid uptake is characteristic of hypothyroidism. So urinary excretion is also important. This is done simultaneously at the same time, because if uptake is more, that is indirectly related to the excretion. So that's why renal excretion of iodine 131 isotope is an indirect evidence of thyroid function. Okay, how much administered dose is given? It is inversely proportional to thyroid uptake. 24 hours of urine is collected accurately and radioactivity is measured. Now, within the lab, we are going to get involved at this point. Okay, 24 hours urine collection is always done by the laboratory. Radiological department will not do this. This is done by laboratory. So this is our involvement in the urinary excretion study. So 24 hours is hours of urine is collected accurately and radioactivity is measured in that urine sample. And normally it's considered to be 30 to 60% of administered dose. So T index plays a very important role. That's why T index, we check the radioactivity at different intervals. Okay. First we measure between 0 to 8 hours at 8 hours. Next we measure at 24 hours and next we measure at 48 hours. And we calculate the T index based on the formula on your screen. So normal value should be between 2.5 to 12. Anything more than 17 indicates hyperfunction. Anything less than 2.5 indicates hypofunctioning of thyroid gland. So thyroid clearance rate, we normally don't do this. This is done. This is a calculated value. It is done by the radiological department. The amount of iodine 131 that is accumulated in the thyroid over a fixed interval in relation to the mean plasma concentration of iodine 131 midway in that time period. Normal value is 60 ml per minute. High clearance is indicative of thyroid hyperfunction, and lower values indicative of hypothyroid status. Okay, so we end the session here.